and GlaxoSmithKline, which gets $181 million. In addition, the U.S. government had decided to de-risk the vaccine production, presumably removing usual safeguards for new vaccines. The U.S. Health and Human Services Department, HHS, is placing orders with manufacturers with which it already has contracts to produce a pandemic vaccine for the never-pandemic H5N1 avian flu. More than $3 billion in federal funds since 2005 have gone toward developing, building, manufacturing, and stockpiling a vaccine to fight that disease. How long do such vaccines hold in stock? Fittingly, given the bizarre nature of the entire flying pigs panic being spread by WHO and CDC, the CDC reports that it expects the first H1N1 approved vaccines to be ready by Halloween. Trick or treat. In Australia, the government has ordered 10 million doses of a new vaccine being developed by CSL. CSL plans to start producing a new vaccine in the next days that can be used for human testing. A vaccine based on the California strain of the virus is being tested in ferrets. China says.
That's horrible, those poor animals. They're creating a disease, killing people off. Those poor animals have to suffer. But did you catch that with that Tamiflu stuff? Causes paralysis. And the scientists and the doctors were baffled when all those kids got like a paralysis thing. I'm not saying that's what it is, but kind of suspicious, isn't it?
That it will have samples of swine flu on hand by June and plans to start manufacturing a new H1N1 vaccine in July. Many drug makers are using techniques of genetic manipulation to produce their new vaccine offerings in a race to market. The Maryland drug maker Novavax, which reported severe annual income losses prior to the current swine flu scare, now is preparing a genetically modified vaccine they claim is suitable for H1N1 flu. The 1976 swine flu fiasco. Once WHO declares a phase 6 pandemic alert, all hell could break loose with governments and population going into panic. Cancellation of international travel, severe domestic travel restrictions, and other emergency measures resembling martial law. In 1976, President Gerald Ford issued an executive order calling for every man, woman, and child in the USA to be vaccinated against a suspected outbreak of swine flu at the Fort Dix U.S. military base. Within months, more than 40 million unknowing Americans had been vaccinated, some 20% of the then total population, despite the fact that no pandemic ever appeared. The flu was restricted to Fort Dix. Interestingly, aside from severe weather and crowded barrack conditions at Fort Dix, every recruit coming in had immediately been given multiple vaccinations as routine, similar to what U.S. soldiers are given today before being shipped to Iraq or Afghanistan, or similar to what U.S. and European soldiers were given in 1918 during the spread of the misnamed Spanish influenza of 1918. Was the Fort Dix wave of illnesses and one death a consequence of the vaccinations? We may never know, as no government agency was interested in pursuing the notion. In that 1976 U.S. swine flu panic, aided by a nervous president eager to win re-election, there were 30 deaths due to adverse vaccine reactions and dozens if not hundreds of cases of the rare Guillain-Barré syndrome, which led to halting of a national vaccination that was being given for a non-existent pandemic, free from liability. There was one very significant difference between 1976 and today, however. In 1976, U.S. insurance companies refused to insure vaccine manufacturers against lawsuits for vaccine-related illnesses or deaths. Today, drug makers need have little fear of damages from product liability lawsuits. They can unleash whatever substances the FDA lets them, and indications are that under pandemic declaration safety standards would be dropped in the rush to stab the population as widely as possible with vaccines. Under rulings made under the Bush administration, vaccines can be labeled as unavoidably unsafe, meaning that when a product is carefully designed, manufactured and marketed, but is dangerous nonetheless, it is not a defective product, even though it might cause injury. Clear. It certainly is clear to the pharmaceutical industry, which lobbied hard for the determination. A decisive victory for the drug industry came in January 2006 when Bush administration Health and Human Services Secretary Michael Leavitt announced a new ruling in defiance of established precedent and the expressed intent of Congress. The new FDA rules preempted any state laws that allow citizens to sue drug makers for producing unsafe drugs under the dubious claim that the FDA, an agency under HHS, had national responsibility for certification of drug safety, and state lawsuits impinged on that national responsibility. As several congressmen at the time pointed out, the FDA
Yeah, the FDA isn't even a government agency, and they've been handed all this power over the people, and that needs to stop too. It should have never started. I mean, there was a time when the FDA actually did their jobs, and the ruling by the Bush administration, or Bush himself, about not holding the pharmaceutical companies liable, that falls under the RICO Act. He had stock, just like a lot of them do, in the pharmaceutical companies and vaccines. So if you alleviate them from having to pay anything, the stock is not going to suffer from it. So that's a personal gain for him. And when they go to force people to have vaccines, and then they have stock or investments in the vaccine or the company or whatever, that's extortion and racketeering. And a lot of people laugh every time you say that, but that's what it is. And you can do that on a personal basis, and I would suggest that the American people pool their resources, get some funds going, and hire a good couple, 4 or 5 attorneys with the funds, and start suing the FDA and suing people individually under the RICO Act, like the Bush, the Clintons, possibly Trump, I don't know, he seems to be, the king of Israel, so he should really just resign and go be president over there, because he doesn't do anything for Americans. That's for damn sure.
70. Bayer Pharmaceutical Company documents from its Qatar biological unit, made public during a lawsuit, revealed that in 1985, Bayer and the FDA colluded by knowingly and deliberately putting thousands of hemophiliacs at risk of death by selling an AIDS-infected blood-clotting drug in Asia and Latin America. See http://www.arp.org/infomail/0503/22.php. The New York Times reported that FDA official, Dr. Harry Meyer, willingly helped Bayer cover up one of the worst drug-related medical disasters in history. Meyer suggested that the issue should be quietly solved without alerting the Congress, the medical community and the public. Attorney, Mike Papantonio http://www.ringofferradio.com/Mike_Papantonio.asp, who with Robert Kennedy Jr., co-hosts, Ring of Fire, said in an interview with MSNBC's Joe Scarborough that this lethal product was also sold in Spain, France, and Japan, killing thousands, especially children. He stated emphatically that the internal documents show that Bayer absolutely, positively knew the product was infected and would likely kill thousands of people, but that it set out to profit. by disaster. See video, http://www.youtube.com/watch. V equals XS3MHJT7 try and search equals Bayer. When the French government learned of it, company officials went to jail. In the U.S., no pharmaceutical corporate criminals have ever been held accountable nor indicted. Bayer was one of the companies that issued contracts for unknown medical substances to be